the Secretary of Health and Human Services, and it's in a national publication, and you didn't know that a 3-year-old girl was being sexually abused on your watch?
I can tell you there were tens of thousands of girls and boys who were sexually abused. The Biden administration lost 425,000 children, and you never complained.
Ron Wyden opened this hearing by saying Robert F. Kennedy Jr. would try to have it both ways, enough to help Senate Republicans ignore the real harm being caused while pushing anti-vaccine policies when he leaves the room. That was his prediction before a single question was asked. 3 hours later, Wyden had the last word. Here is how the hearing went.
Robert Kennedy came into the office of Health Secretary with sweeping promises of restoring the public's trust in government and making Americans healthy again. Now, as the Trump campaign pollsters flail about trying to cover up Robert Kennedy's devastatingly unpopular anti-vaccine policies, I believe the witness will try to have it both ways. He'll serve up enough fakery this morning to help Senate Republicans ignore the real harm that's being caused, while twisting the truth enough so he can go back to pushing anti-vax policies that make kids sick when he's out of the hearing room. The rank hypocrisy of the Trump administration on health can be summed up in a sentence: goodies for those at the top, while American families get sicker and poorer. While Donald Trump and the Secretary are cozying up to insurance executives by handing over more than $20 billion and throwing consumer protections in the trash, Oregonians now play Russian roulette with their health care, actually trying to figure out how they can go without insurance until they qualify for Medicare because they can't afford higher ACA premiums. When Donald Trump cuts the sweetheart deals with the big pharma executives, rural America continues to struggle, often because Republicans have made the largest cut to health care in American history. What these communities are seeing now, I believe, is only a beginning of how things are going to get worse when the cuts Republicans have hidden. And I've never seen this in all my time in public service, hiding the details until after the election. Time and again, when Republicans are put in charge of Americans' health care, there's a never-ending flood of benefits for special interests while American families get left further behind. Nothing illustrates the Trump-Kennedy hypocrisy on health more than their approach to prescription drugs. Donald Trump spent the last year hosting executives from the big pharma companies in the Oval Office. He boasted of so-called deals to bring down the price of medicine. The details, the important facts about these deals are totally secret. My staff spoke with each company involved in these deals. The only thing that's clear is the list of goodies that the companies got in exchange. Robert Kennedy is here this morning, and he's going to ask Congress to codify these sweetheart deals sight unseen. Let me repeat that. People in Congress aren't going to see the details about these deals. So while the American people wait for their costs at the pharmacy to go down, the administration touts Trump Rx, which actually offers higher prices for drugs than what most people can get through their insurance. There is no bigger fraud on the planet when it comes to drug costs than Donald Trump. Meanwhile, Robert Kennedy has presided over the biggest cut to Americans' health care in history, a choice that's already kicked Americans off their care, forced hospitals to close, and caused health care workers to lose their jobs. Since Republicans passed that law, my staff has been thoroughly cataloging every hospital, every clinic, and every health care provider that has shut their doors, reduced services, or laid off staff. So we have the receipts. There have been over 170 closures and service reductions across 34 states. Nearly 7,500 healthcare workers have lost their jobs across 24 states. These healthcare providers cited the impossible financial challenges caused by the Republican Medicaid cuts. Mr. Chairman, I'd like to enter into the record our analysis.
Without objection.
Now, I recently held a forum with healthcare workers at home in rural Oregon in a place where Donald Trump got better than 70% of the vote. What I heard there underscores the reports that are coming in from around the nation. Healthcare providers are walking an economic tightrope, and these communities can't afford to lose the services they're providing. So, Mr. Chairman, I'd like to enter into the record submissions from 5 states, including Oregon, as well as news articles from around the country that confirm the catastrophe that is playing out on the ground as states contend with the impossible task of implementing more than $1 trillion in cuts.
Without objection.
Mr. Kennedy is the most senior and influential healthcare official in the country. When it comes to vaccines, Robert Kennedy has used this once-in-a-lifetime platform to make parents doubt themselves and doubt their doctors. 90% of Americans infected with measles during this unprecedented outbreak, mostly kids, have not been vaccinated. It is no coincidence that it comes as the person in charge of our country's health care lays out propaganda about vaccines, all on the taxpayer dime. The Secretary has ducked, bobbed, and weaved without taking responsibility of saying what needs to be said. Vaccines save lives in America. They keep kids from getting sick. And yet the Secretary won't say it in plain, straightforward terms. He's repeatedly lied before the Congress. First, he lied to me about his trip to Samoa. Mr. Chairman, I'd like to enter into the record a report by The Guardian and the Associated Press disclosing emails between State Department officials that make it clear that the Secretary was traveling to the island nation to promote his anti-vax views.
Without objection.
Second, he lied to Congresswoman Terry Sewell by denying that he said black children should be reparented if they receive treatment for ADD and ADHD. And he's continued to lie about the Republican cuts to Medicaid, claiming that there have been no cuts. That is an absurd claim that would get him laughed out of any room in rural America where public officials and healthcare providers gather to make agonizing choices about payment cuts at this moment. These lies and misrepresentations underscore why, as you know, Mr. Chairman, I asked Robert Kennedy to testify under oath the last time he came before the committee. Regardless of whether or not he's taken the oath, he ought to remember that you can't lie to Congress. It's a crime. Our witness is going to tell the committee this morning that Democrats are interested in protecting the status quo. Nothing could be further from the truth. The nation's healthcare system is broken. That's only going to get worse with the Republican cuts that the Secretary has been cheerleading for from the sidelines. Right now, Democrats on this side, to a person, are leading an effort to reimagine healthcare for American families so it is more affordable, more simple, and less beholden to the corporate interests that Republicans empower at every single opportunity. My own take is if the Secretary was serious about making America healthy again, he'd be working with us on dealing with these issues rather than going to the side of big insurance and big pharma with sweetheart deals. It's an important hearing, and I look forward to the questions. Mr. Secretary, it sure looks to me like the President is working very hard to muzzle you on the issue of the vaccine question. It is very clear, you weren't mentioned at the State of the Union address. The pollsters that the President has have found that 80% of all voters support the childhood vaccine for measles and hepatitis B, but at the same time, your hand-picked people at HHS voted to end the universal recommendation of a hepatitis B vaccine for every newborn. So my question to you is, we are seeing with measles, we are seeing with vaccines, a problem all over the country, and putting infants at risk like this is so dangerous that a court even blocked your new policy from taking effect. Why would you be doing something that is so awful for kids on this vaccine issue? I know it's been your life work, but you promised that you'd do differently when you came for your confirmation hearing.
Senator, we, under my leadership, handled the measles outbreak better than any country in the world. This is a global outbreak. Mexico has 3 times the amount of measles, and they have 1/3 of our population. Canada has twice the number of measles and has 1/8 of our population. We have a 1,700 case this year. 2,200 last year. Europe had 33,000 last year and 127,000 the year before. There are populations that don't want to vaccinate. Mennonites do not want to vaccinate. They have not vaccinated since 1797. It has nothing to do with me. I have not visited Mexico or Europe. I had nothing to do with the measles outbreak here. We have limited our outbreak better than any country in the world because I've talked to Dr. Abbott or Governor Abbott regularly. I talked to Governor McMaster. We send the epidemic intelligence services into their regions when they need it immediately, and we give them the help we can to end the pandemic. There are going to be people who don't vaccinate. The vaccination levels dropped during COVID because people stopped trusting the American government. I am here to restore that trust.
All I can tell you is that in America today, when a baby is born, doctors give the baby a hepatitis B vaccination on day one. With hepatitis B, we're talking about a serious lifelong illness that leads to liver failure and liver transplants. There is no cure. And as of December, you're still appointing people who are trying to undermine that policy. That's not in the interest of families, and that's why the president's pollsters are telling them to isolate you and keep you from talking about it. But I'm telling you, we're going to make sure that the truth gets out. I'm going to move on now to this.
That's a mischaracterization of the president.
I'm asking the questions, Mr. Secretary. I'm moving on now to the drug pricing question and the disclosure of these deals. These secret deals with pharmaceutical companies set up a never-ending flood of goodies for big pharma. You take Pfizer, for example. The day after Pfizer's CEO stood in the Oval Office with Trump, the company's stock prices soared through the roof. Pfizer's going to get a blanket exemption from Trump's drug tariffs, and all of Pfizer's drugs are exempt from Trump's latest fake scheme to align Medicare prices with those in other countries. So it doesn't seem to me that the American people get a whole lot, from this. And every Democratic member of our committee is demanding that you disclose the deals, the specifics. The public's got a right to know about something of this kind of consequence, and every single Democrat up here wants to see this as a transparency issue. Now, yesterday, you indicated to my colleague, Senator Merkley, that you would give out some information about the deals, but not the real information that would indicate if the deals are so good, why is the Trump administration trying to hide them? So my question to you is, yes or no? This is a yes or no question reflecting the interest of our colleagues up here. Will you commit to releasing your written agreements with the pharmaceutical companies tomorrow?
No, I will not, and I can explain why. Those agreements contain proprietary information and trade secrets. When you pass the Inflation Reduction Act and ordered me to negotiate with the pharmaceutical companies, you put in a provision that required NDAs, because nobody's going to come to the table with me if I start releasing proprietary information. You seem to be saying we were paying the highest prices for drugs in the world. You seem to be arguing that now we're paying the lowest. We've dropped IVF by 83%. We've dropped GLPs by 89%. Insulin, COPD drugs, asthma drugs that the American people, now they're paying the lowest cost in the world rather than the highest. And you want to go back on that? You can do this better than us. We did it because you wouldn't act. You have a lot more power to negotiate than we do. Why don't you just go do it? Well, you've been promising to do it for 20 years, and you've never done it.
Mr. Secretary, we are going to do it. But when you try to hide the information on consequential issues, as you're doing on these Trump RX things, it makes it harder for us to make marketplace forces. You're in bed with Big Pharma.
You're telling me you don't have secret agreements here and secret meetings here in Congress all the time, every day?
Senator Scott.
Thank you. A couple of hours ago, I think you said to Senator Wyden that we now pay the lowest prices in the world for prescription drugs. That is an absurd statement. Nobody in the world believes that. Do you want to correct that statement?
It's for the drugs that are on Trump RX.
I'm not talking about drugs. You said we pay the lowest prices in the world for prescription drugs.
Those drugs we do.
I'm sorry?
For those drugs, we do, Senator.
Well, for certain drugs, but in general, would you agree with the Rand Corporation and every other independent survey that we continue to pay the highest prices in the world? You agree with that?
Many drugs are not covered by the agreements yet.
On average, do we pay the highest prices in the world?
As we always have, except for
That's
the
right.
most common
I'm not
drugs.
saying this is a new development, but you said a moment ago that we pay the lowest prices in the world.
The most common drugs we do are GLPs, or IVF drugs, or COPD drugs, or asthma drugs, for insulin.
Well, let me give you an example. For the cancer drug Opdivo, it costs $260,000 in the United States, costs $56,000 in Japan. We paying the lowest prices, et cetera, et cetera. Senator Welch made the same point. All right, the bottom line is, look, there are thousands of drugs out there. There may be a drug here or a drug there. We pay lower prices. In general, according to the Rand Corporation, we now pay nearly 3 times as much for prescription drugs than 33 other countries in the OECD. You agree with that?
For the most common drugs, we have the lowest price.
Secretary Kennedy, that a 3-year-old girl was sexually abused in a foster home at an agency that you oversee. Are you familiar with this?
No, I am not.
You're the Secretary of Health and Human Services, and it's in a national publication, and you didn't know that a 3-year-old girl was being sexually abused on your watch?
I can tell you there were tens of thousands of girls and boys who were sexually abused. The Biden administration lost 425,000 children, and you never complained.
Whose job is it to inform you of something like this? Because this, to me, is an unconscionable case.
Yeah, but why weren't you worried when he lost 425,000 children? Why are you suddenly worried?
I read this in the
Why are you
newspaper.
suddenly worried about sexual abuse of children now and trafficking when it was mass promoted under the Biden administration, where they gave 425,000 children
Mr. Secretary,
to adults without identification?
I'm asking the questions here, and this was in a national publication seen by millions of people, an unconscionable example of mistreatment of a 3-year-old, and you don't know anything about it.
This is selective indignation.
I'm just going to say.
It's very dishonest, Senator.
We have been working on this for years.
Why don't you help us find those children who are lost, still lost? We found
We're working on this
138,000.
right now, and we'll have additional opportunities to talk to you. The reality is that this has been a long hearing, but a particularly important one, because the view on so many of these issues where you basically bob, weave, and deny, for example, your views on vaccines are toxic. You know, people are suffering as a result of your discouraging vaccination, and American families suffer. And I've asked you repeatedly to give specifics. We had all these members who are on our legislation. All these members say that they're concerned about Trump RX and people not getting fair prices. You could settle this by giving me tomorrow all the details. Now, if you want to talk about redactions or things like that, you can do it, but hand it over now so we can get going. And I think
Why don't you do an agreement yourself? You've had power to do that for 20 years and haven't done it, and that's why I was forced to do it.
For years, I pushed
Why are you
Big
complaining
Pharma.
about what I did instead of doing it yourself?
I'm speaking out today
It's
because
ridiculous.
I think this is a sweetheart deal for Big Pharma, and the last exchange proves it when you kept saying the drugs were cheaper.
It is selective indignation, Senator. It's all tribalism that's just destroying our country.
It's about public service. And
It's not honest. It is not honest.
I yield the floor.
Wyden said before the hearing started that Kennedy would try to have it both ways. He said Kennedy would serve up enough fakery to help Senate Republicans ignore the harm being caused, then go back to pushing anti-vaccine policies when he left the room. That was his opening statement. 3 hours later, Wyden asked Kennedy about a 3-year-old girl abused in a foster home his agency oversees. Kennedy said he'd never heard about it. He brought up the Biden administration. Kennedy told Wyden the conversation was selective indignation and tribalism, then yielded the floor. 170 hospitals have closed. 7,500 healthcare workers have lost their jobs. The Pharma agreements have not been released. Kennedy was not mentioned at the State of the Union. Subscribe and turn on notifications. The record, not just the promises. It is not honest. That was the answer.